we medically prepared to handle it?
Well, that is a question that depends on what we do next. From the federal perspective, the most important obligation we have is to make sure that we are producing enough tests, because that's the key to this, so that it's available for local hospitals and county health departments to be able to test people. That's the beginning of everything. When you test someone, not only do you know if they have it, whether they have symptoms or not, but it allows you to identify everyone they've come in contact with and also test them. And I think that's also important to prevent outbreaks in nursing homes and retirement communities, which is where I want to see this prioritized. There's two segments of our population that I want to make a priority for testing and for treatment. The elderly, people over 60 in particular, because we know that the death rate among that population is much higher than everybody else, significantly higher, and healthcare workers. Because even if a healthcare worker is not symptomatic, if you're a nurse or a doctor and you contract the virus, even if you don't have symptoms, you can't go to work. And we can't afford to lose doctors and nurses, because then we have no one to provide health care. So both medical professionals and retirement communities are the two places that I want us to prioritize the tests, the treatments, and the resources. What we can do now is make sure there are more tests available, and to me that is one of the key things that needs to happen in very short order, that more tests become available rapidly and widely available.
So when? Because that is what your
every
want to know.
So every day there'll become more and more tests available. So by the end of this week, there should be approximately 2,500 kits, each of which have 500 tests in them. Available. That's just by the end of this week, and it'll continue to compound in the days to come. So it's not one of those things where all of a sudden you go from 0 to 1 million. Every single day the capacity will grow, and obviously you still have to ship it, you have to send it, they have to be in place, you have to teach people how to use it and how to read the results. So every day it will get a little better, and that's good, but it can't happen fast enough. And that's why this funding bill yesterday was so important. It'll free up funding for more rapid production of these tests and the distribution of it.
I realize we have to look forward and figure out a way to fix it right now. We're in the situation we're in, but a lot of people are sitting back. Critics are saying South Korea is, you have drive-through rapid test centers in South Korea. They're testing thousands of people a day.
Yeah.
And here, we're one of the most medically advanced nations on the planet, and we can't get this right.
Yeah, and part of it is they had it before we did, and so they jumped on it quicker. I don't know all the details about how they developed their tests, but they jumped on it a lot sooner, probably 4 weeks ahead of us, because they are closer geographically to China and to the source of infection. And they're a smaller country, so the ability to provide tests to a smaller population. But even they are facing shortages, for example, of medical gear, whether it's masks or protective garb for their personnel, because it's testing anybody's systems.
Sure.
So, obviously, look, I wish that we had responded differently in the design of these tests and its implementation. And that's something that needs to be looked at. And hard questions will have to be asked about why didn't we start a few weeks sooner than we did on all this. But we can't let the debate about that keep us from doing what we can do now, which is solving the problem so it doesn't keep getting worse. We also can't be hysterical, because hysteria, more than just inconvenience people, what hysteria does is, imagine if all of a sudden everyone who has a runny nose and a fever shows up at the emergency room. Your hospitals won't be able to handle that. And I mean, not just handle other people that have the same symptoms, I mean handle people that come in with a heart attack or with a stroke or something else. So that's why it's important that I think that one of the things we have to do is the government has to make sure that medical experts, not politicians, not talking heads on television, medical experts are regularly providing expert, credible, and detailed advice about what people can be doing to protect themselves. That has to happen every day, all the time. Our job in public service and government is to set the table for it and then allow the experts to talk to people. We have to develop these tests. They have to get out there quickly so we know the scale of the problem. You can't control it if you don't know where it is. We have to develop an antiviral. And I think there's hope that we can have that available within 60 days to 90 days so that we can diminish the symptoms, particularly on the critically ill. We have to prioritize our resources on the elderly, and that means retirement communities, nursing homes, ALFs, places like that, and also among healthcare workers. Because even if a doctor or a nurse is not symptomatic, if they are infected or are potentially infected, they have to be quarantined for 14 days, which means they can't work. We can't provide healthcare without healthcare workers. And ultimately, we have to develop a vaccine. That's 18 months away. So we got to do all these things as we work towards the vaccine. We have to do all those things at once.
And you say the antiviral may be the bright spot in this conversation.
Well, the good news about the antiviral is that the researchers were able to get samples from countries outside of China and begin working on developing antivirals. There are clinical trials now ongoing with antiviral treatments in a number of countries. both in China and outside. Some of those clinical trials the results will be back by April. Some hold great promise. They seem to be working. And so the question is, if we can identify what works to take a disease that requires someone to go on a ventilator and just make it a miserable, I feel really sick, but I'm not going to die type disease, that's a big deal. And developing that and then producing it, making sure it's safe, and getting it out there to people should be among our highest priorities. And there's money in what we passed yesterday to help accelerate that. Listen to experts who know about this. Some of it sounds really simplistic, but it works. Avoid people who are sick. If you're sick, avoid contaminating other people. Obviously, the hand washing and that sounds silly stuff, but it actually does. The things we should do every year to avoid catching the flu or something else, do those things. By the way, I think it's a good idea to get a flu shot. It won't do anything with coronavirus, but if you get sick, we'll know it's not the flu. And that's really helpful as well, because right now they got to rule out the flu. If you are sick and you feel symptoms, call your local hospital, call your local health department, call your doctor and ask them, this is what I'm feeling, and get their advice. Should you come in or should you not come in? And if you do come in, they'll tell you how to come in. Maybe they have a different ways to avoid infecting other people. But I also want them to know that where we are today is not where we need to be in terms of resources and availability. But I think we have finally begun to turn the corner, and it's not going to happen overnight. But more tests will become available, even as we're developing an antiviral. And I'm hopeful. I know it sounds like a long ways away, but in the next 30 to 60 days, you will see appreciable differences in the availability of the testing, and hopefully in the availability of an antiviral. And last but not least, I think all of us at every level should be more cognizant that by and large, if you get this, you're either not going to have symptoms or you're going to be sick for a couple of days, but you're going to recover. But we really need to be concerned about protecting the elderly, about people in nursing homes, even among people in retirement communities, because that's where we could see tragic outcomes. And so we should all be in agreement that we should prioritize whatever we have and are going to get to help them first, to help the elderly and to help healthcare professionals so they don't get sick and they can still be available to help people.